April 1st, the United States Department of Health and Human Services began the process of terminating approximately 10,000 employees per instruction from the Trump administration and the Secretary of Health, Robert F. Kennedy Jr. This in addition to 10,000 employees who have already agreed to voluntarily separate. Many employees arrived at work and were asked to line up outside of the building to find out whether or not they still had a job. Other employees learned of the layoffs when their ID badges stopped working. The administration has stated that it intends to cut 2,400 employees from the CDC, 3,500 from the FDA, 1,200 from the NIH, and 300 from CMS. These agencies all operate under the flagship of HHS. Representatives for the respective agencies have stated they do not anticipate this resulting in an interruption of services. However, now that the entire staff, that's 10 people, from the Low-Income Home Energy Assistance Program, or LHEAP, have been cut, it's difficult to imagine that people who benefited from that program won't be affected. One point that I want to make abundantly clear. This is not a situation where individuals were brought in and had their performances evaluated. This is a slash and burn, and it will absolutely affect everyone, particularly people who are low income. But anyone who benefits from any form of medical or scientific research, this will affect you.
Today, 20,000 jobs are being cut across critical public health agencies. The FDA losing 3,500 jobs. These are the people responsible for ensuring our food, medicine, and medical devices are safe. The CDC losing 2,400 jobs, which means fewer resources to track and control disease outbreaks. The NIH losing 1,200 jobs, delaying life-saving medical research. And CMS, Medicare and Medicaid services, losing 300 jobs, which will slow down services for millions of Americans who rely on health care assistance. And that's just the beginning. This government is restructuring HHS into a new entity called the Administration for a Healthy America. But many experts say this is just a way to shrink the federal government and weaken public health protections. So, why is this happening? This newly appointed secretary, Robert F. Kennedy Jr., says this is about efficiency and cutting down waste. But let's be real, how does gutting the agencies responsible for pandemic response, vaccine oversight, and healthcare regulations make anyone safer? These cuts aren't just numbers on a spreadsheet. They have real-world consequences for all of us. Fewer FDA inspectors. This equals more risk of unsafe food and drugs reaching the public. A weakened CDC equals slower response times to deadly outbreaks and public health threats, like measles. Fewer NIH researchers equals delayed progress on cancer treatments, autoimmune disease research, and other life-saving medical breakthroughs. Less oversight at Medicare and Medicaid equals more barriers to healthcare access for vulnerable populations. And here's the kicker to all of this. These layoffs come right after the one that's in the White House revoked collective bargaining rights for federal workers. That means those that are being fired have even less power to fight back. Coincidence? Or a calculated move to weaken public health agencies from the inside? The question is this really about efficiency? Or are we watching public health get dismantled in real time? What do you think?